It's definitely an experience that I could have never prepared for. I don't think anyone gets pregnant thinking that they're going to be pregnant during a pandemic. Hi, my name is Brittany Jarrett. I currently live in Morgantown, West Virginia. I've lived here for the last 10 years. I live here with my husband, Zach, and my son, Henry, who's almost 2 years old. My whole pregnancy, of course, was definitely not what I imagined it was going to be. Me and my husband had to utilize reproductive medicine in order to get pregnant with our son. So the journey to conceive him was long to begin with. And then once we found out we were pregnant and got through the initial appointments, that's when COVID really set in and kind of changed the progression of our pregnancy from that point on. So we didn't have the normal experiences that most tend to have during pregnancy, like sharing it with their families, gathering together at different milestones during the pregnancy. So whenever I started to get to the point that labor was going to be in the upcoming weeks, things were changing by the day as far as what restrictions were going to be required whenever I went in to have my son. We knew pretty much from the months leading up to my delivery that nobody was going to be allowed in except for my husband. But even in the weeks leading up, we really had no idea what that was going to look like. So being in the hospital once we got admitted, it was just my husband that was allowed in. He was not allowed to come and go. We were required to stay on the unit. And we were supposed to wear a mask basically at all times, unless I was actively in labor and pushing. And then after having my son, we were moved to a very small recovery room. We stayed there for several days after having him because he required some additional medical treatment. And during that time, we weren't allowed to leave. We weren't allowed to have anyone come and visit. So we were kind of on lockdown in the hospital until we were able to finally be discharged and then go home. So it definitely didn't stop with pregnancy. We started to face all sorts of other things once I, had him. First being off is, we had several doctor's appointments that we had to go to in the newborn days. And, just giving birth in the days prior, I wasn't expected to take him to all of those appointments by myself, not allowed to have any other caregivers or partners there with me, so my husband was not allowed to go in. And I was also trying to establish a breastfeeding relationship at that time with my son. So trying to juggle all that while getting to the appointments and trying to maintain our safety with having a newborn in the world was incredibly difficult. I feel that I am in a particular situation that is very unique because not only, did I navigate this pandemic as a first-time mom and a first-time pregnancy, but I was also a healthcare worker and a nurse at that who was very much having to face COVID daily. I currently am also in school to become a women's health nurse practitioner. So I will say that my day-to-day life is immersed in evidence-based research, following all of the most recommended guidelines that are the most recent guidelines that have been put out. So as soon as COVID started, of course, I started trying to follow whatever research was out regarding pregnancy, lactation, effects of the unborn baby, all things like that. So whenever there started to be talks about vaccines, and that's, that being our major way to mitigate this disease, I turned to research. The next thing I would do is turn, to my providers. So talking to my primary care provider, my OBGYNs to get their recommendations. And of course, I got support from all avenues that I reached out to and came to the decision easily that I wanted to be vaccinated as soon as I was able to. As someone who decided to breastfeed my child, I was already keenly aware of all the health benefits that it could provide. And being in this unknown pandemic, as a mother, I wanted to do whatever I could to protect my son. So vaccination was a no-brainer in that sense because I knew that that was really the only way that I was going to have to protect him. And I continued to breastfeed him and am still currently breastfeeding him. And I will say that COVID and the pandemic was a large driving force to that because I knew that it was a way that I could provide some immunity for him. I did have some like mild side effects in the days following my vaccine. Not so much following the first dose, a little bit of an achy arm, just like the flu shot. The second dose, I did have a pretty good response to, was mildly fevered, body aches. All lasted about 24 hours and was quickly gone. I think that the first thing is just to let you know that your fears are completely valid, and whatever thoughts and concerns that you have about getting vaccinated during pregnancy or while lactating are valid concerns. But I hope that you will keep an open mind and take this opportunity to reach out to someone in your life, whether it's your OBGYN, your women's health care provider, your primary care provider, or another trusted resource, and I hope that you will start the conversation with them and ask questions and arm yourself with the information that you need to be able to make an evidence-based decision that works for you and your family and also will protect the ones around you.